world headquarters of common sense.
Talk Radio.
I mean, you've got, really a very similar story to tell, along with Steve James. That you've been working in the NHS. You worked through COVID. You were one of the people we were all standing on our doorsteps doing this for, thanking people. Now we're going to get you the sack, apparently, because you're refusing to have treatment. So people listening to this might go, "You're a doctor. You're an expert in infectious diseases. Why on earth aren't you taking this vaccine? Are you anti-vax?"
Thank you. Yeah, no, I'm definitely not anti-vax. And look, I think vaccines are really, really important. And so we have to be very careful how we use them. And so it's really important that we preserve people's confidence in vaccines. There are lots of diseases that we control very well using vaccines. And so I think that using this one-size-fits-all model, it just runs the risk of really driving scepticism.
Well, yeah, we saw the anti-vaxxer against MMR based on Andrew Wakefield's, let's face it, blatant lies about the evidence he presented on a link with autism. We've seen a lot of fallback. I mean, I'm a great fan of vaccines. They save lives. There are millions of people alive as a result of them. But for you, you'd made a decision. You didn't want to get the COVID vaccine. Now, there were people in tears. I can remember in this office when the vaccine was rolled out, that very first time, there were people really feeling quite emotional. I was among those that, wow, this was going to be the end of the line. Now, of course, we're still not there yet. And the vaccines haven't turned out to be the panacea when it comes to freedoms, if not for big help in terms of people getting seriously ill and dying. But if you've been working in a hospital throughout, you must see the benefit of them. So why do you think that you don't need to get the vaccine?
Yeah, so, I mean, I agree that we should really celebrate the fact that we do have vaccines, and the fact that they are reducing mortality and hospital admissions in people who are at risk of severe disease with COVID-19. So that's great. But the issue is that they're not interrupting transmission. And that's a fact that the Prime Minister acknowledged himself back in October. Yeah. So that's well known,
and even less so. Well, more so with Omicron, in terms of most people like me who've got Omicron have actually had an infection before.
Absolutely. So, given that, what we should be doing is moving from a model where we use vaccines to control disease, rather than this aim of interrupting transmission, which they can't do. They can control disease. Having said that, at the same time, it's really important that we acknowledge the importance of personal autonomy. That's a big step to be mandating people, in this case, in healthcare workers, to have a vaccine against their will. Yeah. And if you want to do that, you have to have really good evidence that it's necessary. And the evidence that is now building isn't just that that we're not sure. It's that we know it doesn't make a difference
in terms of the transmission. So the issue, if you were working throughout, I think you had COVID around the same time. I think I did very early on, and you've then continued to work, and you've not been infected again since. And you've presumably done antibody tests, and are of the view that you've already got the same protection you would have got from the vaccines, and therefore you're being asked to take a vaccine, which and again, government and many scientists in this country seem to dispute this, but I think the evidence is really mounting, is it not? And would have been standard immunology knowledge until COVID, that people who had a prior infection have greater protection than those who've had a vaccine. And yet we seem to have thrown that sort of really quite common knowledge out of the window.
So, yes, unfortunately, lots of things have been thrown out the window that were generally accepted 3 years ago. So that seems to be what the situation is.
So your view is, I don't need it myself. I feel that I'm protected. Even if I had it, it wouldn't protect my patients because I could still pass it on.
Yes. So my view is that given that I've had the infection and that I've worked with patients with COVID-19 for the last 2 years and have undoubtedly been repeatedly challenged with the virus, I can hand on heart say that I am as immune as anyone else can claim to be.
Yeah. And therefore you'd be asked to take a medicine, a treatment that you don't need and you don't want. And do you think that there is the threat that some people say, well, it's just care homes, well, it's just NHS staff, it's people working with vulnerable people, the elderly, there's a duty of care that actually, once it's everyone in the care homes, once it's NHS staff, that actually it will become effectively everyone? I mean, a lot of us, including me, already feeling it with international travel. Basically, if you ain't jabbed, you're really not going to be able to travel abroad anymore.
Well, that's the concern, obviously, isn't it? And so, you know, where does this end? At what point, once you decouple policy from basic evidence, then the sky's the limit. And I know that sounds slightly alarmist, but that is the problem with doing that.
That is the concern, isn't it? A lot of people have said to me, look, it's perfectly reasonable. And again, I was very much in two minds. I had an aunt in a care home and she'd been in a hospital months beforehand. And you know, seeing the level of infections being passed around hospitals and care homes was concerned. But again, I do think that I've sort of come around to the idea that actually the principle of bodily autonomy is so vital and so important and so great that actually you can never throw it away. But people say, well, that principle's already out the window, the NHS, the requirement on surgeons in particular, but other staff working in the NHS to have the Hep B jab. But actually, that's not the case, is it? That argument is completely debunked by the reasons for which it's given. And it's not about protecting the patients. It's about protecting the staff from the patients. And there isn't a requirement to have it at all. There's no legal requirement to have it.
No, it's not mandated in law. But I think the other thing to say is that there is a recognition with hepatitis B that somebody who has been infected and is no longer infectious wouldn't necessarily need to submit to vaccination but that, all that aside, I think that is a distraction, because the point is that in hepatitis B we have a vaccine that's very effective at preventing transmission. We know that, and that is and that's not the case with COVID-19, particularly with Omicron.
Yeah. So it's just not a fair comparison. Look, time's against us. I mean, time's against you right now. In terms of your job, you've spent years training, spent years working. You like many others on the front line dealing with COVID, absolute heroes during this pandemic. When other people are sitting at home on their laptops with their soy lattes, clapping for you, but leaving you on the front line. You're going to, unless the policy changes, lose your job on the 1st of April. The Health Secretary said they are putting this under review. If they don't change the policy, you are willing? You're willing. That's it. You will leave the NHS because of this.
Yes.
That's an incredibly brave move.
It's not. This is so important that I think, and a lot of my colleagues feel the same way.
Yeah.
And each have their own personal circumstances. And I think there are a group of us that are willing to leave, but there is a much bigger group in the NHS who oppose this, but for personal reasons can't necessarily walk away. Yeah. And so I mean, a recent study showed that 5 out of 6 NHS workers opposed the mandate. That's a lot of goodwill to lose.
And again, from people who've had the jab themselves, and again, I think there's a lot of people, and I'm included in this, who felt like pressure to get the jab where they didn't think we really needed it. And I think that's where a lot of people are. I think you're incredibly brave, and I absolutely salute you for standing by your principles. I really do. I think a lot of people listening will be cheering you on there. Dr. Simon Fox is an NHS consultant who faces losing his job despite working on the front line, being an expert in infectious diseases. I mean, we are living in insane and terrifying times.
Good talk.
Hot talk. Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV. The world headquarters of common sense.
Talk Radio.